There's a lot of challenges that faces rural Texas and really rural West Texas and the Texas Panhandle. You know, if you go drive around the Texas Panhandle and you see how wide open it is, people are proud of their independence here. Going back to when this area was first settled, in order to make it out here, you really had to just rely on yourself.
Many of the senior adults are very proud, and they don't want to take a handout, even though they are probably the most deserving. And that's another challenge with our senior adults. It's hard to find out that they're struggling.
They are quietly suffering, and you combine that with transportation issues, all of a sudden you have someone who really can't access food.
Problem is we just don't have the resources that an Amarillo, a Dallas, a Wichita Falls, a Lubbock has. And so that's the challenge.
Frankly, I think it's going to be very difficult to overcome those challenges.
One of the biggest challenges for the Texas Panhandle is just how large it is and just how rural it is in terms of the area that you have so many people spread out over.
You know, 24 of our 26 counties are extremely rural, some of which are considered frontier even. And so there are some unique challenges in the Texas Panhandle that you don't see in other places like cities like Dallas or Houston or San Antonio.
And rural hunger definitely differs in many ways versus urban hunger.
Because you're trying to get access, right? And that getting access is just fundamentally a harder problem when you are, especially in a rural place.
You know, our smallest county is Roberts County, and there are more cattle than people in Roberts County.
A lot of our rural communities, you have seniors out there that are either caring for children, caring for grandchildren, on top of what they are facing on a daily basis with limited and fixed incomes is really what brought it forward to me. It's like we've got to, you know, really focus a lot more on our seniors. And I think it was amplified even more so by the pandemic.
The state of Texas is sending medical supplies and personnel to Amarillo and Lubbock this weekend. It's an effort to help tackle a spike in COVID-19 cases and hospitalizations.
You know, the pandemic had a real obvious way of unveiling the vulnerable populations.
The High Plains Food Bank was working with those counties to make food available to the individuals that were under a quarantine type situation. And they hadn't recognized that we have seniors that did not have the groceries they needed to adequately have food security.
You can't really go door to door and ask questions in a town of 400 because then people aren't able to maintain their privacy. We don't want hungry older adults to stay hidden, but we also don't want to force them out and call them out in any kind of way. So when you look at data, you have to have enough individuals that there's privacy. And in rural communities, that's really challenging. There are communities and there are cities that have less than 400 people throughout the Texas Panhandle.
This is going to go to, these are all hot items. My name is Kay Calvert, and I'm with Tri-County Meals here in Kittiquay, Texas. We just started with homebound delivered meals, and then a couple years ago, we started working on the new food pantry building. When we first started, that's the first thing that they'd say is, oh, we don't need those. We don't need a program like that. It's a wonderful idea, but we don't need a program like that. We take care of our neighbors. Well, it didn't take long. We found out we really don't take care of our neighbors. I mean, you have to seek some of them out, and then you hear their story.
And will you tell me where you grew up?
Here in Turkey, Texas. I was born and raised here, went to school, and I worked at the bank for many years and raised a child. Oh, we had 3 grocery stores. We had 2 or 3 gasoline stations. We had a bakery. My dad was a barber. We had 2 cafes, and a dry cleaner. I mean, this was uptown when I was young.
But a lot of rural areas, it is emptying out. You don't have, and you have the average age in a lot of rural areas is becoming older and older.
People is leaving, and their kids don't ever come back. They go to the city and
They never come back?
just to visit.
Well, census data shows more people are moving to the Lone Star State than any other state in the U.S. Close to 500,000 people moved to Texas since July of 2021. It's now home to 30 million people, second only to California.
But I do know our school sizes are shrinking. They're estimating within the next 5 years we will no longer be a 2A district, but a 1A district. So yes, the numbers of kids are down.
For many younger individuals, there's a lack of opportunity. And so you don't have the infrastructure that is available and offers all sorts of different resources if you have a vibrant community.
Kids are leaving because there are not jobs for them there, and that leaves that older population in place.
If they go off to college and they're more white collar, they have to move to where there's jobs, even blue collar jobs. There's just not a lot here. We have migrant workers in the farms, and we have some large family farms, but for the most part, there's just not a lot of options here.
Sometimes the younger people, that's the only people that some of these homebound people even see.
And the grocery store, they open till like 9 o'clock. So if we wanted pop or candy, we could go over there and get it.
And it's not like that today?
No, we go to Allsup's, that's all we got.
Oh, when you talk about rural, we have what we call food deserts, and that's where people can't even go into or find a grocery store within driving distance.
I run out of something that I need. I can drive to Allsup's, but I'm not supposed to be driving. And the closest grocery store is 10 miles. So it's hard sometimes to get what I need.
Let's say somebody that lived in Skellytown. Their options are to drive to Pampa or to drive to Borger. And it's, 15, 18 miles either way that they would go.
New data from the American Cancer Society says simply having access to healthy foods can mean a longer life. But without it,
what we found was that the life expectancy was shortest in the so-called food deserts.
We have to begin thinking about a food desert from my perspective at the individual level. For somebody with a car who is 45 years old, has been driving for a long time, and is comfortable, he or she might not mind having the nearest food store be 5 miles away. Similarly situated senior who doesn't feel comfortable driving may find that 5 miles is way too far away. Heck, that senior may even find that a mile away would be too far away.
Almost half the census tracts in the Texas Panhandle are considered food deserts. And so if you have a food desert and you combine that with transportation issues,
Now they're worried about how they're going to put food on the table.
I don't see it getting any better. I see it getting worse. I see us having to spend more money on the pantry items that we're having to purchase.
Big time supermarkets have a tendency to hurt small town businesses. And that's, again, a struggle. That's what makes Memphis kind of like an island, is it's hard to compete with those big, large grocery store chains. We do have a grocery store. It's Davis Thriftway. The Thriftway tries to stay competitive pricing wise, but there are just some things they can't. And so they're buying, higher priced goods. It's just the reality of it.
Customers at the store I spoke with told me rural grocers are a must-have despite those bigger city stores.
During the wintertime, if we didn't have a store here and there's a big storm out and you needed things, you're out of luck. This store here is a lifesaver when it comes to bad storms. You can't go nowhere. And if you have to, you can walk down to the store and get the things you need, until they get the roads open, the trucks come in and stuff. So during the wintertime is the most important.
The irony for many rural communities is that they are surrounded by farmland that's growing fresh food. There's just no access to it.
Well, I'm a diabetic and I have a heart problem and I can't walk. There's something wrong with this right leg and I have no balance, so I'm in constant pain.
If you needed to go to the hospital, how would you do that?
Well, I called the fire department and the ambulance and they come get me.
And where would they take you?
I go to Lockney.
How far is that from here?
A good hour.
So if you have a serious health issue, you can expect that it's going to take over an hour for you to get any kind of treatment or help?
Yes, sir.
Memphis no longer has a hospital, so the closest real health care we have is Children's Regional Medical Center. It's 30 minutes away.
He's in what we call a healthcare desert, which is Hall County. Memphis is in Hall County. There are no healthcare providers in that entire county. Not a nurse practitioner, there's not a pharmacy. Obviously, that's a very vulnerable part of the state of the Texas Panhandle.
One of the things Hall County had to do was really strengthen our EMS hospital services, or getting people to care as quickly as possible.
Rural ambulance service is in its own emergency, according to a study from the Rural Policy Institute. It found long distances and challenging terrain prolong emergency response times. There's not enough money to make ambulance service viable, and there's a lack of regional EMS plans to coordinate services.
We see a lot of people that drive 30 minutes at a minimum to just see their primary healthcare provider. And if he identifies a problem that they have and needs to send them to a specialist, most of those specialists are here in Amarillo. And so if you're talking about driving from Perryton to Amarillo, you're talking 2 hours.
Some of the seniors are relocating just because their children are in metroplex areas like Dallas, Amarillo. So that they're forced to, because their health gets to a point where they just can't take care of themselves.
And Texas Panhandle wide, our healthcare costs are really high. That is definitely a topic that is out there. Healthcare costs are high.
Northwest Texas healthcare system has released a statement regarding a series of layoffs at its facility. The hospital is, quote, restructuring certain functional areas and departments within Northwest Texas healthcare system to increase operational efficiencies and reduce costs during this challenging time in the healthcare industry.
The fundamental assumption of economics is scarcity. There's a reality of there's just a scarce amount of resources. And so we're just trying to all do the best we can to make the best we can of these scarce resources, whether it's healthcare or food.
If you start at one end of the spectrum saying, let's say with preventative healthcare, if you don't have just even a clinic or a pharmacy that you can go to and get a pneumonia vaccine, then puts you at risk of being hospitalized with influenza pneumonia or pneumococcal pneumonia or COVID or any of those things.
It's very hard. I live on Social Security, and it's hard to stretch it, but somehow God helps me. I don't advise anybody to get a divorce, because a single mom it's so very hard, because you've got to feed the kids. When I was 40, she graduated from high school, my daughter. She helped me so much, you don't know. And she helped other people. She was one of those that she was there, and yet people might not even know, but she was there to help anybody. I know she took in a little boy one time in high school. He was single man. He had a single mom. They didn't have the money to buy senior rings or invitations. My daughter did it. I mean, I'm not bragging about it. I'm just saying she took him on because she knew he didn't have nobody else. And she would never want me to tell that. But
How long ago did she pass away?
4 years. And I just got real depressed, and I may cry. I just missed her, and I went into a deep depression. But I'm much better now. I still cry. It's just a love, you know. To live out here like I'm doing, it isn't easy because of Tri-County Meals, the food bank, my hospice volunteers. That's the way I make it every day. And my Lord.
You have to listen. And listening is so important Because unless we hear the stories and unless we understand how people got here, then there's not a way to come up with a solution. You don't understand the problem. I think when it hit home the most for me was when I was sitting in a room with one of our patients who was in our chronic care program. They were a diabetic patient, and I was asking them about their blood sugar. And I said, hey, how's it going with your diabetes control? And he said, well, my sugars are kind of up and down, doc. And I said, well, are you taking your insulin? And he said, well, no, not all the time. And immediately the response is, I'm like, well, why not? We're getting this medicine for you. Why are you not taking it? And he looked at me and he said, you know, doc, I don't take my insulin if I'm not sure I'm gonna have enough food to eat that day. And so that sort of hit hard, because the danger of him taking insulin without having food is that he could bottom his blood sugars out, he could go into a hypoglycemic coma. And so he'd crafted sort of how he would address his healthcare needs around sort of his access to food and whether or not he knew he was going to have access.
The thing is that not just buying food in general is nutritious food.
Recognizing and understanding that food is a key component to managing so many health issues. You talk about diabetes and hypertension and some of those things. Food is a key component to managing those illnesses, those chronic diseases.
Type 2 diabetes has all sorts of awful things that can happen after you contract the disease, like neuropathy and peripheral neuropathy. That means that you lose the feeling in your feet in what we call protective sensation. And protective sensation means that, like when you touch something hot, you immediately reflex away. Or if you step on something sharp, you immediately feel it, and you protect yourself that way.
Fruits, vegetables, like good food, it's expensive. So sometimes they just buy whatever they can.
So people with food insecurity tend to lean towards the foods that are not recommended, the processed foods, the packaged foods, high in sodium, high in triglycerides, not a lot of fresh food. So not only do they get higher incidences of those diabetes, hypertension, but they can also develop vitamin deficiencies as a result of the types of foods that they're eating.
How many times have I seen people who have type 2 diabetes who are construction workers, and they just step on a nail and they can't feel it, and they end up losing their job at the minimum because they're out for 2 months, or they lose their life or their leg because of that type of injury.
Those are big killers up in our area because they are not found until the damage has been done. You've got medications that make things better, and then you can do things like diet and exercise to address the needs the body has to continue being healthy.
And when they go into that chaos mode, they're not thinking about things that would have normally been just part of a routine. Taking your medicines every day, making sure you're exercising, making sure you're doing things. Those things go out the window and you go into just survival mode.
The risk of someone falling is indirectly related to the diameter of their thigh. So in other words, your quadriceps muscles are very important to your balance and to your risk of falling or lack of risk of falling. So how do you keep a strong quadriceps? You have to be active, right? You have to be able to exercise and get out and walk. And when people lose that ability, they become more frail and they have an increased risk of falling.
When we first started Amarillo Wesley Community Center, it was like more recreational program, fitness, like exercises and stuff. But then we realized that the seniors in this area, the barrio, needed more than just recreational. Some of them didn't have transportation to go to medical appointments.
The whole Panhandle has seen a growth of immigrants that have come in, and some of them are from totally different cultures that we've seen.
People of color and different types of social backgrounds, ethnic backgrounds, are at a high risk for having food insecurity.
There's a huge disparity in how food insecurity affects
our neighbors of color versus white neighbors.
That's 29% of Black people in the region who are facing food insecurity. 1 in 6 or 18% of Hispanic people and 1 in 13 or 8% of white people are food insecure.
Some of our seniors, they live in areas that don't have like a grocery store. They probably have convenience stores, but they don't have a grocery store where they sell healthy foods.
If you really tried to determine how many good grocery stores, let's say, are in some of our neighborhoods that are more challenged and culturally and racially diverse.
Well, let's say if we took one of the communities, the North Heights, as an example, there are not a lot of grocery stores close to them. Probably some of the closest ones they would purchase at would be, say, the United or the Walmart that are out there off of the Tascosa Road area. And that could be a 4 or 5 mile one-way trip for that person.
And some of them, they just can't afford a car.
Culturally speaking, Latin people have been known to take care of their elders. How would you respond to somebody that said, well, senior food insecurity is not an issue for Latin seniors?
No. We Hispanics, we don't really use probably daycares or nursing homes. But, a lot of our seniors, I guess their families, their sons, their kids, they have their own job, they have their own responsibilities, and they just start not forgetting about them, but they have their own things going on. And some of our seniors, like I said, they live on their own.
My name is Fela Lopez, and I was born in Rio Hondo, Texas. After my husband passed away, it was just me. We had been married 35 years, and so that kind of made me not want to eat. I was home by myself. I didn't want to eat, and I would cry a lot. There's a lot of benefits of interacting with people, and it's very nice to be in a Wesley Community Center.
I enjoy myself. I don't have to stay home and by myself.
Clarence Blackman is an 81-year-old Army veteran battling prostate cancer. But cancer wasn't the reason he called 911.
What I need is someone to get to the grocery store and bring me some food because I need to eat something.
All across society, we're facing, I call it, a loneliness epidemic. There's so many people who are lonely, okay? And so even thinking about some of these people who maybe they're seniors and maybe they do have, not a low income, but they struggle on a day-to-day basis because they don't have anybody that cares for them. They don't have friends who care for them. They don't have family nearby that care for them. So that's some of the other reasons why people fall through the cracks.
This idea of a lot of older adults being alone now due to a lot of different circumstances, whether that be divorce or being widowed or never married, not having kids, they're alone. And it's harder to address hunger and food insecurity by yourself than it is with a group.
Their dementia, their depression, these kinds of things that are so common in elderly people. They lived alone. It would exacerbate these underlying mental issues,
The depression comes because they feel like somehow they can't provide for themselves and they don't want to ask for help.
I have a granddaughter that comes and takes me to the doctor, and the boy, the grandson, he just had a new baby and he's busy, but still you ought to come. And the weekends I hardly ever see anybody.
It is just as much not only the food, but it's also a wellness check.
Our local Meals on Wheels is important, and it's important for two things. Number one, it gets a decent meal into the home of seniors, but it also allows them to check on seniors.
Yeah, lunchtime. It's lunchtime, girl. Hey, Sophie. How you doing, man? Okay. How are you? I'm good. How are you doing?
I do think that some of the work that we're doing can help find those people, can help connect them to the resources that they need, and it can help improve their quality of life.
You have a pretty big picture of, there's food and there's people hungry, but how they got here, there's hundreds of stories.
I know that you can't drive over to Kittiquay. Finish that and we'll be able to get you food pretty quick.
Right here?
Uh-huh. It's just...
This dang pen's running out of ink.
Writing too many love letters.
No, bills.
And until you listen to those hundreds of stories, you really can't come up with a solution. And there may be 100 solutions that have to be to address a complex situation like that.
I can't think of any more helpful as they are toward me. They make me feel happy. And I don't know what we'd do without them.
It is going to take the entire Texas Panhandle to address the issue because we're in this together.
There's some good news here with respect to this. I'm optimistic. I'm really optimistic about
They bring it to you?
my house. Yeah, High Plains Food Bank.
They do it for y'all.
It's our distribution truck. Yes.
Right,
The distribution, the homebound get a few box, plus their little vegetables and stuff. Yeah. So nice. I get too much. I mean, some of it I have to share.
Funding for this program was provided by the Mary E. Bivins Foundation and viewers like you. Thank you.